Yes, we go on to the Tim Ply's case.
Well, thank you, Blair, for inviting me to join this session and also to talk about cricket. So I'm glad to be a finisher because I'm not very good with the bat, but I did my med school in Australia, so I grew up watching Shane Warne, so I learned a lot of spin bowling from him. So let's talk about aflibercept now instead of cricket. So this patient actually switched to aflibercept 8 milligrams after a poor anatomical response with faricimab. So a patient who was on Q12, Q16 weekly dosing of faricimab initially. So this is the patient initial evaluation. You can see quite a lot of fluid, intraretinal fluid, baseline CST of about 466. So this patient was loaded with faricimab initially. You can see after one dose, some reduction in macular fluid, further reduction, and then I was able to extend it to, we tried to extend quite quickly because patients in Hong Kong are frequently self-financing the drug, so there's no reimbursement for them, so the financial burden is quite substantial. So when I tried to extend to 16 weekly injection, unfortunately the fluid came back again quite rapidly. So I moved down back to 12 week, and then it started to respond again with good improvement in vision. So from 2080 up to about 2050 now. So this patient basically maintained on Q12 weekly injection despite having still a bit of fluid, but the patient said, I'm happy with 12 weekly injection. But there was actually recurrence of fluid after the 7th injection. So, and the fluid actually was getting worse despite having, this is like 6 weeks after the 7th faricimab injection. So, and then we got hold of aflibercept, 8 milligrams. So I asked the patient whether the patient wanted to try it, and the patient said yes. So I gave a dose of 8 milligrams and actually got a fair bit of response, 100 microns responses 4 weeks after the last dose of 8 milligrams. So I loaded the patient with second dose, and patient just came back for follow-up about 5 days ago, and actually did even better, another 30 micron reduction in macular thickness. So I'm now trying to extend the patient on 8 milligrams of aflibercept. So this patient switched from faricimab to 8 milligrams aflibercept with anatomical improvement, reduction in macular edema, and also a bit of subjective improvement in terms of visual improvement. So I think sustained disease control could be achieved with 8 milligrams aflibercept in this patient with persistent DMO. With that, thank you very much. So please vote for us.
For a great case. I think we have excellent cases with different kind of spectrum presented here, and that is what we are looking forward to, especially once we have a new dose and of course molecule being older with us, how that is doing. Yes. So with this we go on to little bit of this thing, how if I have to ask a question to the audience and raising the hand, how many of you would be ready to switch from 2 to 8 milligram in your cases if you have situation the way it has been explained? So how many of you would do it once it is available? With raise of hands. That's great. That's really very